We have worked for the past 5 years, after there was a period of time for about 5 years where teachers got nothing. And then after the recession, this board, the 2015 board that came in, really placed an emphasis on trying to catch up. And so we've been very diligent in giving step increases and raises every year since in the past 5 years. So that won't happen next year, given what we know about the budget at all, which is a travesty, really. As Dr. Nicely was talking about, we're about 38th in teacher pay in the country. And, it's just a profession that I think is undervalued and underpaid. And maybe one of the silver linings that'll come from this is that there might be a higher value placed on the job that teachers do once people really understand what that vacuum is like trying to fill with parents and the like. So the biggest cut is teacher salary. We were also going to add some life counselors, which we won't be able to do. We thought that was important. More and more kids today need help early on. We really want to identify kids who are having any kinds of issues at all, stress or anxieties. And the earlier you catch that, the better off you are in trying to solve those problems so that they don't compound over the years. So life counselors was important. And there were some construction projects that we would have liked to have done, but doing so wouldn't look good given the fact that we're reducing or not paying teachers money, so we're just not going to do them. Cosmetic things in nature, so we just won't do that. There is a potential, though, if in fact the economy turns around rapidly as it did decline, which was in a matter of 8 weeks. Look how far we've gone down with sales tax revenues and things like that. So sales tax revenue is the lifeblood of our budgets, as you probably know. So at the state level and at the county level, that's where the revenue comes from for us. We get very little federal money in Roanoke County school system because we're of a higher income level than the city. But if the economy, the way that the agreement that we have with the county, and I think what could happen with the state is as revenues increase over the course of the year next year, then more money would come to us so that the budget that we're going to be passing isn't etched in stone. So now, that could work both ways, unfortunately, but we're hoping and being optimistic is that if there is a treatment and if there is a vaccine, it's only natural that things will really start to move. And I do think there will be some pent-up demand out there just to get back to normal. There may be an aspect of the economy that doesn't bounce back as quickly, but I think maybe there's a silver lining that we'll get more revenue next year. Well, it's a few $1 million on teacher salaries. I'm just going to give you an order of magnitude number would be somewhere around $2 million that we won't, actually we can't afford to pay of that money we've reduced. So it's mostly on the salary side. And then there's the normal hiring that we do. We have a number of teachers who retire every year. We would like to replace each and every one of those, but we probably won't be able to do that in every case. So it's teacher salaries. It's also not hiring as many folks that you had planned to do. There would be less in the way of bus replacements. I mean, there's a lot of things that we had planned to do that we won't be able to do with this budget. I'm not worried about the instructional side because we have a lot of experts who are handling that. What I'm worried about mostly is that what is this new normal going to look like? And we have to plan for that. And absent of a vaccine or a treatment, when we reopen, we're going to have to take extraordinary measures with respect to, let's say, healthcare, that we've never done before. Let's just think about the logistics of this. First of all, I did some calculations to talk about what, let's say an average classroom size is 700 square feet. We're actually going through this exercise, believe it or not, in each and every building, looking at the square footage in each classroom, and then what it would look like to social distance in that space. For example, if you would agree that a student would take up, let's say, 1 square foot of space sitting in a desk, you've got to have 3 feet that way, 3 feet that way, 3 feet that way, and 3 feet that way. That's about 50 square feet, roughly. So you have to actually start to do that calculation of what it would look like. And when you do that, in an average class size of 25, you're down to around 13. So that's the kind of stuff that we're actually looking at, is what would it look like? What would that classroom look like just to keep kids apart? So we're going through that exercise. Each and every building will be doing that exercise. The other thing you look at is what's the logistics of where do you start to do, how do you identify kids who might have a fever? We actually may have to get into the testing business. We may have to have people standing at the bus with a thermal scanner, scanning a temperature. We may have to do that before the kid gets on the bus. If we have a child who has some symptoms or a fever, we're actually planning on isolation rooms to put these children in. So the thing that I think is most complex is how do you run the buildings in a safe way if there's no treatment or vaccine, so that you don't spread the virus. Because one thing what we do know, and one of the things I wanted to say is that we on this board, we're keeping politics out of this and all of that noise that's going on right now, and looking at the data and the science. That's what we're going to focus on, and what our health professionals tell us to do. And so I'm worried about all of our employees who may be at risk. When you look at the vulnerable age groups, do you know over half of our bus drivers are over 65? So we've got to worry about that. And then there's a percentage of our student population who have serious health issues, chronic conditions that have to be taken care of, diabetes, asthma, kids who have treatment for cancer, autoimmune diseases. All of that stuff puts them in a highly vulnerable position. So the thing that I'm most worried about and that we're focusing on is how do we operate a building in a safe environment? So it's a whole new, the other thing is that we may be bringing lunches to desks. We may actually have teachers going into a classroom rather than having the kids migrate to another classroom. So when you think of the logistics of how do you do this and keep kids as safe as you can and your staff as safe as you can, that's a tremendous amount of planning. And what my hope is that the localities aren't left on their own to do these things, because that could be a nightmare. That we need some state coordination here to do this, I believe. And I think at the end of the day, it's going to cost more money to do this than we're going to have budgets for. And so I really do hope that there is another round of federal help for states and localities, because if the lifeblood is sales tax and your sales tax dries up, the other thing we have to worry about is if the budgets are that bad next year, you could be looking at force reductions of police and fire and school teachers if it gets really bad without that kind of help. So those are the things that we're worried about. But just keeping our kids safe and what that's going to look like, that's the kind of planning that we're doing. When I say it's highly complex, I think it is.
I mean, whoa.
Yeah, think about it. And so I can't imagine, and I could be wrong, that we would just say, okay, September 1st, October, full back to schedule. I don't think that's going to happen. I really don't. I can't imagine that happening. We'd be putting a lot of people at risk, I believe, doing that. So, but what we can't do is we can't continue to operate like this, and not having school at all, that's a nightmare. Our kids will never recover from that. So we have to do something and do the safest thing that we can. It's not a failing of the school. I can only speak for the Roanoke County school system and the amount of, I mean, I have really been extremely, I've had the blessing of having a lot of experience with some planning in these kinds of scenarios. And I will have to say that Dr. Nicely and his staff I could match them against anybody that I've ever known. They're good. They really are good. They've thought of everything. Ken is extremely brilliant, articulate. He's a good teacher and a great planner. He really is good at this. And so we're so lucky to have him at this moment in time because he's really thought a lot. As a matter of fact, I think some of these sessions that they've had with the state superintendent, I believe Ken was the first one to float the idea of having staggered sessions, that it gets people thinking about it's a much better alternative, I think, than shutting down. Because the failing that we have now, and I can't blame the school systems, is that I'll tell you what was an eye-opener. When we started delivering food via our bus routes, and you really start to see where some of our children live. I'm pretty sure that those kids aren't getting a lot of help for a lot of reasons. Either the parents don't have the time, they don't have the wherewithal, or they're working 2 jobs. And so a lot of these kids may be home alone, in my view. And so we're really fortunate in Roanoke County, and that's probably a small percentage, but I'm worried about those kids. I'm worried about the kids whose parents don't have the wherewithal, the ability to teach. They're going to be left behind. They're just dropping through the cracks, and we're doing the best we can. Now, my wife's a teacher. She's calling her students once a week, calling them just to see how they're doing. So she's working probably 10 hours a day at home on the computer, having meetings and doing that. So I know all of that is going on. I'm not worried about the teachers slacking off or anything like that. If anything, they're working harder than they worked before. But I'm worried about the kids. I'm worried about many of our kids get the best care they get coming to our building every day with food and nurturing and love. And so all of that is kind of being missed right now in some cases. So those are the things that are making my hair a little grayer, things like that. But a lot of planning, and we'll be ready and we'll do the best we can.